thank Forever Giving for organizing such a wonderful meeting for all of you all. Come, give Forever Giving a clap. Yeah. One of the most valuable give back to all of you are their so-called their loyal customers, plus also their business associates. One of the most important things you have to do is what? Is to equip with correct knowledge, so that you can share with many people, so that they can use the knowledge appropriately to prevent diseases. So today my topic will be heart health, prevention versus cure, all right? You know, the health trends have changed over the years. Way back in 1960s, whenever somebody is admitted to the hospital, you ask your parents, no, why is so-and-so admitted to the hospital? They'll tell you, oh, he has tuberculosis, he has chest infections, no? He has all those problems, what we call infectious disease. No? We talk about, diphtheria, pneumonia, infectious disease. But now you go around to any hospital, be it a National Heart Center, Singapore General Hospital, NUH, Kutepot, people admitted for a few diseases. One of them is cancer, heart disease, stroke, diabetes, etc. As you realize that our disease pattern has changed over the years. As a matter of fact, you really look at the statistics, actually quite staggering. In all, there are about 16.9 million people have what we call circulatory diseases, meaning that it's related to blood vessels, be it in the heart, in the brain, or in the bodies. 7.5 million people have what we call coronary heart disease. Okay, 5.5 million people die of stroke, and 10 million people die of cancer. In fact, how many people have high blood pressure? As the estimate at the current time, is about 1.3 billion people. It's a whole of China population. People suffering from high blood pressure. Okay. If you go and watch fireworks display, and you get, if you get killed during the firework, you're real unlucky. Because the chances is 1 in 340,000 chances. But do you know 1 in 24 people had stroke? 1 in 7 people had cancer, and 1 in 5 people had heart disease. Okay. When you talk to your children, they all want 5 C's, 6 C's, and all that, right? So now, actually, as far as health is concerned, we do not want the 3 C, the capital C, I say. One is cancer, one is coronary heart disease, and the third one is what we call chronic degenerative disease, such as high blood pressure, diabetes, osteoporosis, etc. Are Singaporeans healthy? Are you healthy? Yeah? I don't know. Okay, let the figure speak for itself. This is the latest, actually, Singapore nationwide survey. The last survey was done in 2009, all right? Cancer, out of every year, there's about 17,000 deaths. Out of this, cancer constitutes 29.3%. Coronary heart disease, 19.2%. Stroke, 8%. But you really look into more carefully. What we are interested today is talk about cardiovascular health. Or you look at it. Total number of deaths, you look at it, it has been stable throughout the various years. You see, 2007, 2008, hovering around 17,000 deaths. Out of this total death, ischemic heart disease, that means coronary heart disease, constitute about 19.2%. Cardiovascular, cerebral vascular disease means stroke. Is about 8%, and other heart disease is 4%. Actually, we will add up all the cardiovascular diseases. It accounted for 1 in 3 people. Actually, the reason why they die is related to the blood vessels diseases. In fact, sometimes when you talk about all these things, people don't appreciate what you talk about. Do you know every day there are 15 people died from heart disease and stroke? It's quite a lot. Sometimes we have an explosion, or 10 people die, the world news and all that. So, but every day there's 15 people die of heart diseases and stroke. So these are common things. Today, I'm going to talk to you on the commonest heart diseases is coronary heart disease. As you know, heart disease, we have valvular heart disease, myocarditis, meaning that inflammations of the heart muscles, congenital heart disease. Today, I'm not able to complete everything. Anyway, I want to focus on the most important conditions called coronary heart disease. Okay, don't worry, I will inject some of the Chinese during my most interesting part of my talk. So you bear with me, because if I were to do bilingual presentation, you'll take up to 5 o'clock, then you all cannot go back. Okay, one of the most important things to understand about coronary heart disease is that you have to understand the structure of your heart vessels. Okay, when we talk about structure of heart vessels, we say that we have 2 coronary arteries, the left coronary artery and the right coronary artery. On the left side, it divides it into 2 main trunks. One is the white structure is called left anterior descending artery. And the orange structure here is what we call the circumflex artery. Don't worry about the names. But I want to tell you, most important, the take-home message is that out of these 3 blood vessels here, this is right coronary artery, the most important blood vessel in your heart is left anterior descending artery. It's called LAD, all right? Because the main pumping chamber of your heart, which is the left ventricle, 60% of blood supply is supplied by these blood vessels. In other words, next time if you have heart blockages, you ask the doctor, where is my blockages? Or where are my blockages? Okay, if tell you left anterior descending, then your heart will sink a little bit more. All right, because that's the most important blood vessels. The second thing you need to understand is that where are the blockages? If the blockages is here, it's very different from the blockages here. In other words, the higher up the blood vessels blockages, the more serious the condition. 这一张是很重要的一张图片。我们的冠状动脉血管，心脏的冠状有3条大条的，一个叫前降支。前降支是最重要的一条血管，因为我们的左心室的血流供应68%是由前降支所供给的。所以一旦比如说你医生跟你说你有心脏血管阻塞，你问医生说我的阻塞在哪里？如果是前降支的话，不好消息，因为那是最重要的一条血管。然后阻塞是在前端还是尾端？越前端就越大路阻塞越危险。所以这个是一个很重要的一个信息，你们要记得。我们时常讲 we always say, what are the symptoms of heart disease? How come some people, the first time when they presented heart disease is the first time they drop dead? All right? So there are people like that, right? But fortunately, there are some people whereby they do present with some symptoms, okay? Okay, we're not talking about silent ischemia, or we're talking about the various other presentations such as stable anginal, 稳定型的心绞痛, unstable anginal, sudden death I mentioned earlier on, heart attack, and also heart failure. Nowadays, medical therapy is becoming very, very effective. People normally don't die from heart attack now. They survive, but they end up having heart failure. So you're getting more and more people now with weakened heart, poor heart. So the main purpose is not to get into this stage. All right. Now, first of all, let's talk about stable angina. The reason why the heart muscle aches is because of demand versus supply. Because of narrowing, there's not enough blood supply going to the heart muscles. That's the reason why the heart aches. One other important thing I want to tell you, dead muscle doesn't ache. 心死了不会痛的。So don't be happy. 我没心痛咧。没心跳, not a good news. 没心跳 means muscle completely dead. Muscle completely dead, no pain. They only have what? Chuan. They only have shortness of breath. Do you understand? So important. Only living muscle aches. 心死了冇嚟痛。心死會痛. Something similar like that. So you have to understand that. All right. Now, most important thing you have to know is that what are the factors that predispose to what we call chest pain. All right. So there are factors like, for example, you take a very heavy meal, you do exertion, and sometimes you exposed to cold weather, sudden change in weather, or smoking. All these are precipitating factors for having angina. Now, this is the second most important message that you have to go back and bring back home. It's about the percentage of narrowing. How many percent block is so-called important or dangerous? You look at this chart here. This is the percentage block, and this is amount of blood flow. You can see that the blood flow doesn't change very much until the percentage block is 70%. So what does it mean? In other words, any blockages less than 70%, is it important? Yes or no? Hello? Yes or no? No, okay? If the blockages is less than 70%, in other words, the people will not have any symptoms. They still can function normally. Do you all just have lunch? No, huh? Maybe just now, a lot of hoo-ha, excitement, huh? You all are a bit shed and tired already, huh? Okay, never mind. Halfway through, if you are really shed and tired, I teach you something to wake up. Straight away you wake up. Wow! Because those people who fall asleep, huh? They miss a lot of things, huh? They might miss my joke later on also. Anyway, so important thing to remember is that if the blockages is more than 70%, that is considered as significant. All right. Now, each time when we watch drama, when people having chest pain, they're always very dramatic, with the hand in front of their chest, and oh, this heart attack. The children also can tell you, this is heart attack. But unfortunately, not all the heart attacks present this way. Some of the heart attacks present a very vague symptoms. For example, they have pain in between what we call the shoulder blade. They have so-called tightness around the jaw. I have one, Caucasian engineer. He cycles every day to work, He works in Singapore. Then, you see, recently he cycles, he had this cramp in the tummy. So I think you guys run before, right? So sometimes when you run, you have cramps in the tummy, right? So cramp in the tummy, see what? Stomach pain, go and see stomach doctor, lor. So he went to see stomach doctor, had a scope done, nothing wrong. So give him some antacids to take. Then later on, he's still not better, So eventually, he looked at the internet, he came to see me. I say, I better come and see another doctor. So I say, what is your problem? He says, stomach pain. So when I look at him later on, he has many risk factors for heart diseases. He's about 62 years old. He has high blood pressure. His cholesterol is terrible. He's not very obese. He exercises quite regularly, but he has family history. So when I check him, he has very bad blockages in 3 of the blood vessels. I did 4 bypasses for him. Do you understand what I'm trying to say? So sometimes the presentation is so atypical, and you thought it's due to stomach ache, but it turned out to be what we call heart blockages. Now, this is for women here. For those ladies here, put out a hand. There's always more ladies than men attending all the health talk. I don't know why. What happened to your husband? Bring your husband here, because they are the ones that are more likely to die from heart attack. Now, so next time, please bring your husband here. Okay, for ladies, one thing you have to bear in mind. I'm talking to the husband now. When your wife go back and complain that I'm tired, okay, I have this neck pain, I feel very lethargic. Please don't ignore them, because they might have symptoms of what we call heart diseases. Do you understand what I mean? For women, usually they don't present with chest pain. When they present with tiredness and all that, the husband will say, see lah, who asked you to produce too many children? You see lah, why you work so hard? Work at home, be business woman. Woman, I tell you, I salute you. You are a mother, you are a business woman. You all have to go back and cook. A lot of things. Educating all your 包個料啦. Husband 冇做物件呀. So that's what husband do. So for the husband, please love your wife more. Do you understand or not? Because they have multiple roles. So when they complain to you about some aches and pain, listen to them more. Do you understand? Okay, don't worry. Don't say all tiredness is chest heart attack. No, not like that. After I teach you how to identify. Now, so we talk about stable angina. I think what we are more interested is this condition, what we call unstable angina. In other words, there's a change in the pattern of your pain. All right. For example, sometimes you only have pain when you go up the stairs and all that, or you start doing exercise. But now your pain comes on even when you shout very loud, or when you try to do some training. You start to have this chest. This might be a symptoms that you might have what we call a changing the pattern of your pain. This is what we call unstable angina. You really look at it. You see, what happens is that our blood vessels can become narrow as a result of accumulation of this fatty material inside the wall. And when the wall When the plug is very stable, you are safe. But what happens when the plug is unstable? When it ruptures, this is the whole series of events. When the plug ruptures, the platelets will glue together and you travel down and cause a complete heart blockages. So this is what we call the causes of heart attack. After this, I'll tell you a little bit more. So when you have heart attack, what do you need to do? Please don't drive to the hospital yourself. I have people, you all laugh. I have people who are suspected of having chest pain and all that. They drive to the hospital. In fact, one of my so-called, also a doctor, no? So he had this chest pain. Lucky his wife is also a doctor. So they drove from East Coast to General Hospital. And suddenly, he actually arrested. His heart become, what we call, the heartbeat become irregular. So the wife had to do a CPR, wait for the ambulance to come, and fortunately, it saved his life. So can you imagine, sometimes you lose your control while you are driving? Fortunately, he actually loses consciousness when he comes to a stop. Can you imagine when you go off? You not only kill yourself, you might kill a lot of people. So when you suspect you have a heart attack, please don't drive to the hospital. Call 995. Don't call 991. So must remember the correct. And don't call my handphone also. I can't help you. Some of my business friends say, can I have your handphone? I say, okay, but don't call me when you have a heart attack. I will wait for you in the hospital. This is exactly what happened when you have a heart attack. Your heart, from a normal rhythm, it becomes what we call irregular. This is a lethal rhythm, what we call ventricular fibrillation. Fibrillation means that the heart is not squeezing. It's just doing this. Okay? So the only way to cure is to defibrillate. So remember, time is muscle. The faster you get to the hospital, the better it is. As I mentioned earlier on, nowadays, there are much better medicine now to treat patients with heart attack. So much so that they don't die from heart diseases. They die from chronic heart failure. Okay, now, how do I know whether I have heart diseases? So a lot of time, people come to see me for so-called screening. So do I have heart disease? So there are so many tests that's available. Please don't believe that all the tests needs to be done. Okay, so every time when we do something, we always have to individualize. Okay, so at the individual level, we say there are tests like electrocardiogram, what we call 心电图, some blood tests like hsCRP, apolipoprotein A, or CT calcium score, treadmill, etc. Commonly done tests are ECG, treadmill, and CT calcium score. Blood tests, usually, we don't do this two very commonly. Now, ECG, is it useful? ECG is only useful when you already know that you have heart diseases and you have chest pain. Then when you come to me with a chest pain, we do an ECG, you have changes. That means you're likely having a heart attack or something like that. But normally, ECG, when you go and do an ECG, is pain already gone. For example, yesterday you had pain, today you go and see a doctor, you do ECG, normal. Normal ECG doesn't mean anything. Do you understand what I mean? So very important, third take-home message. Normal ECG doesn't exclude you do not have heart disease. Okay. Now, as I said, the blood test is not commonly done because this blood test is a marker of inflammation. Later on, I'll tell you a bit more. So only when people who are suspected having very high risk, then we do the marker. Now, calcium score. CT calcium score is one of the ways to supplement our accuracy. So because, for example, when we do a treadmill, it's only 65% accurate. So we are not sure that whether you definitely have or have not coronary artery disease. So we do what we call the CT calcium score. All right. So as I said, treadmill is only 65% accurate. And for people who are diabetic, remember the fourth take-home message: diabetes do not complain of chest pain. Those people with diabetes, they don't complain of chest pain. They only complain of shortness of breath. 糖尿病的病人，他没有心闷、心痛了他只是觉得，我最近很疲倦，走路很喘。所以有时候，所有糖尿病的病人，我们都需要跟他做一个我们叫做跑步机的测试来检验出到底他的心脏血管有没有阻塞。其他 this list of what we call screening tests should not be routinely done. Because sometimes when you go and see some doctors, they will do this CT coronary angiogram routinely because there's a high risk of radiation-associated cancer. Okay? In the past 5 years, the cancer rate for lung, from breast has gone up in America because everyone go in and zap. Can I zap it? No, to see whether my heart has blockages. So don't do that. So this one has a lot of what we call radiation. The rest of the blood tests usually is part of the packages, but it's not specific for any heart diseases. Okay, we said we completed the symptoms. We've done the screening test. Next, brief words about treatment. How do we treat? 来，我们讲一讲治疗。First of all, you have to understand what are the aims of treating coronary heart disease. First of all, we want to what? To improve blood flow, so as to relieve the symptoms. 因为我们最主要是说，比如说他有心闷、有心痛的话，我们要给他一些药，吃了之后他不会心痛、心闷，对吗？或者不会喘。Okay, but that is not the most important aim of treatment. The most important aim of treatment is actually to prevent plaque rupture. Because when the plaque ruptures, this is the one that is going to kill the patients. Okay? How do we prevent it? First of all, we have to control all the risk factors. 事出必有因. What are the risk factors? So if we can control this, we can actually prevent heart attack, prevent heart failure, and improve survival. So these are the aims. When we have blockages in the heart disease, heart vessels, how do we decide when to do surgery or when to do balloon and all that? So this is a bit technical, so I don't want to bore you. Basically, it depends on how many vessels that are bought, whether the blockages is more proximal or more distal, and what type of blockages is this, okay? And sometimes with certain scanning, we can do the amount of what we call the heart muscle at risk. So the higher the heart muscle at risk, definitely the higher the chances of death, okay? This is very technical, as I said. Don't worry about that. You leave it to the doctor to decide. Now, in terms of treatment for coronary heart disease, there are various different treatment. Medical treatment, balloon angioplasty, or what we call bypass operation. Okay, let's talk about medical treatment. 药物治疗主要是什么？治疗它的 risk factor 风险因素，比如说你高血压、糖尿病高血脂，我们用药来控制你的风险因素。Next thing is to give you medicine to improve the blood supply or to reduce the heart muscles from working too hard, such as the one called beta blocker, nitrates, calcium channel blocker. So who has heart disease now here? All don't have. Very good. Oh, you're forever living very good, no? All are very healthy. Okay, good. Give yourself a clap. Okay. You know, you all are very good. You're bringing very good products into the market. Arginine, remember you say, for male with, you know what I mean? Improve the sexual performance. Anyway, arginine works by dilating the blood vessels, okay? So next time, so knowledge is very important. So when your clients is taking this medicine called nitrates, be careful, don't sell them the arginine, you know, because when they dilate too much, what happens? They'll faint. Do you understand what I mean? So must be careful about certain supplements. For healthy people, no problem. For people who are taking medicine already causing vessel dilates, be careful about that, because I want you all to be the best group of people with knowledge to promote certain products, okay? So these are some of the things that you have to bear in mind, okay? Medical therapy also includes what we call antiplatelets, like aspirin and Plavix. Now, the next modality of treatment is what we call balloon. You know that a lot of people have balloon angioplasty. Balloon angioplasty, basically, there are three things that they do. They just do the balloon to blow the to lesions. They put on this what you call the bare metal stent, in us no drug-coated stent, or they put in a drug-coated stent. And this is how they do it. See, if there's a narrowing here, first of all, they put a guide wire and they inflate the balloon, and then from there, you can see the lesions get kind of stretched. So sometimes during the process of doing it, some rubbish can go down. Sometimes that's why sometimes when you do certain ballooning during acute heart attack, the person actually can die because the clots get traveled downwards. Okay, but for people who are not having what we call acute heart attack, like for example just blockages, heart, like fatty thing, it usually doesn't cause much problem. Anyway. So normally, we do the balloon, then we put in the stents. Stents are metal things inside the blood vessels. Unfortunately, ballooning do have some problem. If you just do a balloon, the restenosis rate is 40%. In 6 months' time, 40% of people will come back. If you put in a metal stent, 20% of people come back. Now with the drug-coated stent, it's very good. Okay? Less than 10% chance of coming back. But there's a problem also. You see, even the drug-coated stent is much better than what we call a bare metal stent. You can see this is the lumen of the blood vessels. You can see it become narrowed. This is the stent. If you just put a bare metal stent, while you put a drug-coated stent, you can see the lumen become quite big. Unfortunately, the drug-coated stent has a problem of causing what we call blockages of the heart vessels later on. Okay, especially when some people stop taking this what we call the antiplatelet medicine. Okay, so there are things like they can suddenly get clot off and they die. So this is stenting. Now let's talk about bypass operations. Bypass operations, what is most important about bypass operation is that we do the bypass operation by creating what we call breaches or new road. Okay? For example, if there's a blockages here, we create a new road so that the blood will flow via the new road. This is the most important what we call bypasses that we do for your heart, is using the artery to bypass the artery. The rest of it, you will use a piece of vein. Okay, as you said, as you realize that artery lasts longer, vein doesn't last much longer. Okay, so bypass operation is suitable for people with triple vessel disease, 3 blockages, patients with poor heart function, patients who are diabetic, and patients who have what we call diffuse small vessel disease. So these are some of the things. Now, I throw away all those things. I have been an inferior doctor for the past 26 years. Because we only do what? Cutting people out, 开心. No good. Over the past 15 years, I've been doing a lot of what we call education. Because a lot of time when people, after they open their heart, they say, Doc, can I not see you again to come back for a second operation? I say, sure you can. That is how I've been doing. I'm very, very interested in doing what we call heart health education. So today, the whole purpose of your here today, that is the most important part of my talk. The first part of talk you hear already good. So, you know what is the symptoms, how to do for tests, how to treat the various treatment, medicine, treatment, balloon, stenting, and surgery, right? You know already. Now the most important is prevention. Do you want to prevent heart disease? Yes? Not loud enough. Do you want to prevent heart disease? Much better. I'm sure Forever Living can do much better. Okay. One of the most important things about any treatment or any disease is to go into prevention. Because if you can prevent it, it's far better than spending the money and give it to me. Okay? One bypass operation costs about $25,000 to $30,000. Okay? Okay. And ballooning and stents depends on how many stents you put in. I want patient put in 8 stents over the course of 2 years. One stent, $6,000. Kuiluya? Yeah, 6,000 times 8. That's excluding doctor's fee. It's just a stent, the metal stent. So you want to waste so much money on treatment? No. You better know how to prevent it. Now, the major problem of our preventions currently is what? A lot of people have a knowledge gap. 道听途说. They know a little bit, don't know right or wrong. They just do things. The more important thing is that you have to fill your knowledge gap. You have to bridge your knowledge gap so that you know exactly how to prevent having a heart diseases. Classically, when we talk about risk factors for heart diseases, these are the risk factors that we go through. In other words, when you come to see me with some complaint of that chest discomfort, shortness of breath, or maybe you quarrel with your boyfriend and say, "Wow, it's now zat leh." You come say, "Dr. Tang, got heart attack or not?" So we say, okay, let's go through this thing. Okay, this is what we call the risk factor. The more you have, the more worried I am. Okay, so these are the risk factors which cannot change. These are what we call non-modifiable risk factor. 这个是不可以改变的因素. For example, old age. Everyone grow old, right? Except Forever Living. Hey, give yourself a clap lah. Ah. Good. Yes, accept. So old age. And next is male sex. Male usually, unfortunately, they have diseases 10 years younger than the female counterpart. All right. So women only have it when they post-menopause. Genetic factors, very important risk factors. Remember I told you the engineer? Actually, one of the strongest risk factors here is genetic. Because he does have genetic factors, I cannot take the thing too lightly. All right. Now, these are what we call the modifier risk factors. Enough things can change. Like, for example, as a result of lifestyle, for example, high cholesterol, high blood pressure, diabetes, smoking, lack of exercise, obesity, stress. Stress are usually don't consider as one of the risk factors. Why? Singaporean, everyone has stress. So that's why I always very admire your MD. CG has no stress. Why? Because he stay in Malaysia. Okay, I'm good with time, right? If I'm not good in time, you please tell me. I can always speed up. So that's the problem with Singaporeans. Very stressful. So now, among all the risk factors, which are more important? A lot of times when patients ask me, Doc, I have this, which are more important, right? This is the Interheart study. Interheart study was published in 2004. It looked at about 53,000 people who had a heart attack. And they looked at their risk profile. And that is what they found. You look. If you have abnormal blood lipids, your risk of having a heart attack is 3.25 times higher. If you are smoking, 2.87 times. If you have diabetes, 2.37 times. If you are hypertensive, you are 1.91 times. If you have abdominal obesity, you have 1.62 times. In others, if you have 2 or 3 risk factors, it's multiplication, it's not plus. Do you understand what I mean? So if, for example, you have abnormal blood lipids, 3.25. If I smoke also times 2.87 times. So it's not plus 2.7 times. Okay, so that's very important message to tell you. The more risk factors you have, the higher your risk of having what we call AMI, acute myocardial infarction. Now, the other thing they also notice what? What are the things you can do to prevent heart attack? If you take fruits and vegetables every day, your chances of having a heart attack is decreased by 30%, no? Okay? If you do regular exercise, your risk is decreased by 14%. So don't say, so a lot of Singaporeans say, every time I jog, I exercise a lot, no? How come I still have a heart attack? Because then why? After jogging, they eat meat. They don't eat fruits and vegetables. Normally, you go to hawker center, you see people eat things. Very interesting, no? Especially the young one. All the vegetables, they'll take it out. Take it out. Then sometimes they eat those fish noodles. I like the 鱼片汤. Now I say I always ask them to add 𝐾𝐨𝐧𝐠. And these young people down there take out one strand of 𝐾𝐨𝐧𝐠, take out. Then they put it on the plate. There I say, can I have it? Just kidding you. Inside my heart I say, I want it more, but yet people are not eating it. You understand what I mean? So the take-home message for you is that if you want to prevent heart attack, eat more fruits and vegetables every day. It can decrease by 30%. All right. Exercise only 14%. No. Right. The other important thing you have to understand is this, what we call the timeline. Hardening of the blood vessels, called atherosclerosis timeline. You can see it started off with injury to the inner lining of the blood vessels. And from there, the first 10 years, second up to third 10 years, you can see the plaque accumulates. And by the 4th decade, you can see that it's getting thicker and thicker. There's one mother who asked me, Dr. Tan, when should I start living healthily? I say start from the time you are born. Right? Actually, that should be the way. Okay, can I ask you a question? If those people get the questions correctly, answer correctly, I'll give you a book later on. When do we start aging? When does aging start? Yes? Any? 25 years old. Yes, some more? 30 years old. Some more? 4 years old. The day you are born. Good. Any more? Answer? Wrong. You start aging at the time of conception. When the sperm and egg comes together, when you start grow, that is where aging starts. Correct or not? In actual